So good morning or good evening or whatever time it happens to be. Welcome to our video series on spine and head conditions. Today in this first video we're going to be looking at basic anatomy of the spine and head and some common conditions that occur when things go wrong. So without further ado, let's get started.
So going over the skull and spine, there's a little bit of basic anatomy that you should be aware of and terminology that we'll be using. The skull itself is not just one bone, it is a series of several bones that over time fuse together. And then your spine is going to be divided into different areas. Your cervical spine, which is the neck area, thoracic spine, which is mid-level, lumbar spine, which is lower down, and the sacrum and coccyx, which actually come down and into the hip. There's different ranges of motion that you should be able to have in this area. In the neck, it's going to be a little more versatile with flexion, extension, lateral flexion, and rotation. And with the thoracic spine, your rib cage is attached. It doesn't move quite as much as the other areas. You'll be able to do some rotation and some curvature forward and backwards. The lumbar spine, the lower portion, is going to have a wider range of motion than the thoracic, but not quite as much as the cervical spine, and it'll be able to rotate and move side to side as well. So knowing some of the bones of the head and spine, it's also important to know a little bit of the musculature. Though there's a lot that goes on, you don't need to know every little detail. Some of the important things that are often problem causers are suboccipital muscles, and what those are at the base of the skull and attaching to the first and second vertebrae. They are small little muscles that just start the motion of your head in tilting it up to the side, just the small little movements. And when those get strained, they cause headaches and a lot of other problems that can be surprisingly annoying for such small muscles and common in a lot of people. Moving down the back, you get some nice long thin muscles that run all the way up your spine, one even attaching from your hip all the way up to your skull. And these you can usually feel in yourself. They feel like long ropey muscles all the way along your spine. And covering the rest of the back, there are a few others that you might hear frequently: your lats, your traps. Though those function more on the shoulder, they're also going to play a role in your spinal posture.
So let's look at three major pathologies that can happen when things in the spine can go wrong. The first that we touched on briefly in our series with neck and shoulder issues is migraines. Headaches and migraines are a common problem when issues around the suboccipital muscles become tight or constrained. Muscular only can lead to tension headaches that present in the back and can sometimes radiate around through the eyes or around to the temples. But if you have problems that involve pinching of the nerves or interruptions to blood circulation, you can also get a migraine presentation. Migraines, as we know, are a lot more debilitating and come with a lot more symptomology, but they often have a musculoskeletal component around the base of the skull, around the neck, or sometimes neurologically as well. Beyond that, we have the bulging disc, or a herniated disc. So in between vertebrae is a jelly-filled capsule, and not with actual jelly, but a gelatinous substance, and it's meant to help cushion movement between the vertebra to allow you to move without pain and to allow the nerves from the spinal cord to escape the vertebra and the spinal column. And when this disc starts to compress, the fluid inside starts to dry up, or if the spine moves in a particular direction to pinch the disc off in a certain way, what can happen is the disc begins to bulge out in a particular direction, or as it dries, sometimes it begins to rupture, causing a herniation. And depending on the way where it's located in the spine, and depending on the direction of the bulge or the herniation, you can get radiating pains, numbness, interruption to the function of your organs, and other sorts of very chronic and constant aggravating symptoms that can be quite debilitating. Beyond this, another common problem, particularly for adolescents, are scoliosis or other kinds of problems with curvature of the spine. For people who are younger and are still growing, if their posture as they sit at a desk or sit in a chair is repeatedly off, as the spine and the musculature around the spine grows through puberty, that can lead to a curvature that becomes very abnormal, where people have an S-curve, sometimes very pronounced, sometimes very mild, where you wouldn't notice it unless you have a trained eye. And other times, as people get older, if they have spent many years in one particular occupation or one particular position, where, for example, if the shoulders are very rounded forward, if the back is hunched over, the fascia, the connective tissue, can begin to harden in that way, so that a person's posture starts to become this abnormal position on a regular basis. After a while, the spine itself will also begin to remodel, to take that new shape, so that a person's form, they really do end up freezing in that position. Short and sweet, those are issues with the skull and the spine. So in our next video we're going to be looking at some basic stretches and movements that you can do to help keep your spine open and limber in all areas of movement, and help you to lead a more mobile life.